Welcome to Have More Babies, the show that gives you a shortcut to being well-informed.
We take that stack of sources you've gathered, pull out the most important insights, and deliver them right to you.
Okay, so let's unpack this one. Today we are jumping headfirst into a really critical public health issue.
One that affects pretty much everyone.
Antibiotic overprescription. You've brought us a fascinating collection of research, and it's all centered on one big question.
Right.
So the mission today is to figure out if technology, and we're talking specifically about telemedicine, can actually be a scientifically validated solution to combating antibiotic resistance.
It's sort of a silent crisis, isn't it?
It really is.
Because the immediate thing we need to understand right from the start are the stakes.
Yeah.
This unnecessary use of antibiotics. It's directly driving bacterial evolution.
We're training them.
We're essentially training bacteria to become immune to our best drugs.
Right. And if you just stop and think about it for a second, antibiotics were arguably one of the greatest medical achievements of the last century.
Oh, absolutely.
But now, because of overuse, we're actually facing the prospect of a post-antibiotic era, where a simple infection could become deadly again.
Exactly. When bacteria become resistant, when these superbugs emerge, our ability to treat infections gets incredibly complicated.
So that's why we need to first really define the problem here. What is antibiotic overprescription?
Well, it's not just about the number of prescriptions. The sources are clear on this. It's when they're prescribed unnecessarily, or when less potent or even a non-antibiotic treatment would have been better.
And when you look at traditional, in-person medical care, the whole system seems almost flawed from the get-go. It feels like it sets the stage for this problem.
It does. Think about the standard flow of a doctor's visit. There's a high-pressure environment for everybody involved.
For the patient and the provider.
Absolutely.
Yeah.
Traditional care often encourages these hasty prescriptions. A patient walks in with a cough, a sore throat. The doctor has, maybe 7 minutes?
To assess, diagnose, and prescribe, it's a race.
And that rush creates a high likelihood of misdiagnosis, or worse, just handing out a prescription as a default.
And we see this most often with broad-spectrum antibiotics, right? Can you just quickly define what that means for anyone listening who might not be familiar?
Sure. Think of antibiotics in two basic groups, narrow and broad. Narrow-spectrum ones, they target very specific bacteria.
Like a sniper.
Exactly. Broad-spectrum antibiotics are more like a shotgun. They hit a huge range of bacteria, and that includes the good, helpful bacteria in your body.
Which you need.
Which you definitely need. So when doctors are rushed, they often default to that shotgun approach to cover all the bases quickly.
But the cost of doing that is massive.
Huge, because you're killing off beneficial bacteria, and you're increasing the pressure on all bacteria to develop resistance across the board.
So we have this massive threat, antibiotic resistance, and it's being driven by a system that basically encourages speed over accuracy. So here's where it gets, I think, really interesting. Why would a highly trained healthcare professional, someone who knows about this global threat, still fall into that habit of overprescribing?
This is where we have to stop blaming the individual doctor and start looking at the system.
Okay.
Our sources point to 4 major interconnected pressures that really compel providers to overprescribe.
What's the first one?
The first, and this is maybe the most complex one professionally, is the fear of missing a bacterial infection. So many common illnesses, especially respiratory ones, they look identical. It could be a virus where antibiotics do nothing, or it could be bacteria where they are absolutely essential.
So if you're a doctor on a tight schedule, you can't run a rapid test, you're stuck.
You're stuck. You're choosing between 2 terrible options. Withhold treatment and risk the patient getting much sicker later, or
prescribe the antibiotic and contribute to this global problem.
Precisely. That lack of confidence, in telling viral from bacterial illness, it pushes providers to a better safe than sorry approach.
They're treating their own anxiety, in a way.
And their legal risk, not just the pathogen.
That's a huge systemic failure. Okay, let's move on to the second pressure, which is one you hear providers talk about constantly. Patient demand.
Oh, this is a classic. It's expectation management gone totally wrong. Patients come in expecting an antibiotic.
Right, they think, I'm sick, I need a pill.
Exactly. Maybe they saw something in the media, or they remember getting an antibiotic for a similar cold last year. So when the doctor tries to say, look, this is viral, go home, get some rest.
The patient feels like they're being dismissed.
Or that the care was bad.
So it becomes a negotiation, not a clinical decision. I've heard doctors say it's just easier to write the prescription than to have a 10-minute argument.
Which leads right into the third point. time constraints.
The clock is always ticking.
Always. If a doctor has 8 minutes for a patient who is demanding a Z-Pack, it takes, what, 30 seconds to write the prescription?
And how long to explain why they don't need it?
10, maybe 15 minutes of careful, empathetic conversation to explain the difference between bacteria and viruses, outline the risks, and convince the patient that rest and fluids are actually the right treatment.
That time difference is just staggering.
It is. It puts the practitioner in a position where the most responsible action, patient education, is also the least efficient one for their schedule. The economics just push them toward the path of least resistance.
Which brings us to the fourth pressure you mentioned, and this one feels a bit more behind the scenes: financial incentives and legal concerns.
They're thorny, for sure. The sources point to a couple of things here. First, there can be financial incentives from some drug manufacturers to prescribe specific brands.
That's a subtle pressure.
It is, but it's in the ecosystem. But what's more universal is the legal concern. Providers are always aware of potential lawsuits if a patient's condition gets worse.
So they're practicing defensive medicine.
Essentially, yes. Prescribing is sometimes a preemptive defense against a hypothetical worst-case scenario. When you combine that fear of missing something, the demanding patients, zero time, and the legal risk,
You get a perfect storm.
a perfect storm fueling global antibiotic resistance.
Okay, so we have a really clear picture of this four-pronged problem. Now, let's pivot to the solution that's been proposed: telemedicine. How does moving this whole consultation online change that dynamic? How does it fix those four pressures?
Well, it changes the entire structural environment of the medical encounter.
Yeah.
It lets doctors, in a way, regain control over their time and their diagnostic process.
How so?
The critical difference is that it allows for individualized care.
But how does being remote actually give a doctor more time? Wouldn't the platform just push them to see even more people just faster?
And that's the key challenge, you're right. It all comes down to implementation.
Okay.
If you treat telemedicine as just a faster funnel for sick visits, you haven't solved a thing. But when it's structured correctly, like the sources highlight, the reduction in overhead,
No waiting rooms, no transition time between patients.
optimized scheduling. It allows the providers to dedicate sufficient time to the actual case in front of them.
So they can shift from thinking about quantity, how many patients they see, to the quality of that one diagnosis.
Exactly. And when a doctor is less rushed, they can really dig into the patient's history, ask detailed questions, and then confidently pivot to non-antibiotic options first. Rest, hydration, specific over-the-counter meds.
And that diagnostic accuracy is the real key.
That's the mechanism. It inherently reduces unnecessary prescriptions, and because of that, it slows down the development of resistant bacteria.
And this isn't just for acute things like a cold, right? The sources also talk about the preventative power of remote monitoring for chronic conditions.
That's a huge piece of this for preventative medicine. For patients with ongoing issues like heart disease or diabetes, remote devices can track their vital signs continuously.
So the doctor gets a constant stream of data.
Right. And that allows them to spot complications early, say a tiny fluctuation in blood sugar, and intervene with the correct, targeted, non-antibiotic treatment before it turns into something bigger.
Before the patient develops a secondary infection that might need those broad-spectrum antibiotics.
Good, proactive clinical management, which is enabled by technology, just reduces the patient's overall exposure to antibiotics.
And this isn't just a theory. The sources you brought us, they back this up with some pretty solid global evidence.
They do.
So let's look at the studies. Where do we see proof that remote care actually works to curb overprescription?
The data is really encouraging. And what's interesting is how consistent the results are across different types of ailments and even different countries.
So it suggests the structural change is the real driver here.
It seems to be.
Let's start with the U.S. findings.
Okay, so we saw multiple studies looking at acute respiratory infections. We're talking colds, bronchitis, things that are notorious for getting unnecessary prescriptions. And telehealth groups in the U.S. consistently showed a significantly lower antibiotic prescription rate compared to patients who went to an in-person visit for the exact same symptoms.
And it's not just limited to the throat and lungs, right? We saw this for other common issues, too.
Correct. The benefits go way beyond the common cold. A study in Norway looked at patients with suspected urinary tract infections, or UTIs.
Another big one for overprescription.
A huge one. And again, the telemedicine group had a lower prescription rate. And in pediatrics, a Canadian study looked specifically at kids with respiratory issues and found that telehealth successfully cut down on overprescription in that really vulnerable population.
When you look at those conditions, respiratory issues, UTIs, they are like the bread and butter of unnecessary prescriptions because the diagnosis can be ambiguous and it's always rushed.
That's right. And the trend even holds for things like skin conditions.
Really?
Absolutely.
Yeah.
Another U.S. study showed that telehealth consultations for various dermatological conditions also resulted in fewer antibiotic prescriptions compared to in-person visits.
Wow.
So what this convergence of data really suggests is that the remote environment acts as a kind of necessary filter. It forces the doctor to rely more on the patient's history and detailed reporting rather than that quick, reflexive prescribing we see in a rushed in-person visit.
That is a powerful finding. So what does this all mean for the future of healthcare? I mean, before we declare telemedicine the perfect solution, we have to talk about the limitations.
We do. It's not a panacea. It definitely comes with some significant practical hurdles.
What's the biggest one?
The primary challenge is still the quality of medical care for complex or serious cases.
Yeah.
Telemedicine is great for triage, for managing common ailments, but if a patient needs a physical exam, a lab test, a swab,
Something you can't do through a screen.
then the virtual consultation just falls short.
And while technology is the solution here, it can also be the barrier. I mean, the digital divide is a real thing.
It is. Patients who aren't comfortable with the tech or who just don't have reliable high-speed internet, they're going to struggle to access these services.
And that could actually make healthcare disparities worse.
It could. And on top of that, we have to talk about insurance. Even as telemedicine is growing, a lot of insurance plans still don't offer great coverage for virtual visits, and that creates a big financial barrier for patients.
And of course, anytime you move sensitive, private data online, data privacy becomes a huge concern.
Absolutely essential. I mean, these providers are handling incredibly sensitive medical data. They have to use military-grade secure methods and stick to every data privacy policy to protect that information.
Because one big breach could just destroy public trust in the whole system.
It could.
But even with all those hurdles, the sources really emphasize that the best technology in the world won't solve this if the patient isn't part of the solution.
Right. And this is where patient education becomes so vital.
Because it hits that pressure point of patient demand.
Exactly. We have to educate the public on the fundamental difference between bacterial and viral infections. If patients understand that antibiotics only treat bacteria, they'll be less likely to ask for them when they're not needed.
And for those times when antibiotics are the right call, compliance is everything, isn't it?
It's critical. Education has to include the importance of full compliance. That means you have to finish the entire prescribed course, even if you start feeling better after a couple of days.
He says if you stop early.
You're letting the stronger bacteria survive. The weakest ones are killed off first, but the tougher ones are left behind to multiply and pass on their resistance.
So, to synthesize this entire deep dive, what's the ultimate conclusion here? What is the real potential of telemedicine to change the course of antibiotic resistance?
I think the takeaway is that telemedicine is much more than just a convenience. It's a necessary structural intervention. By creating space for individualized care and allowing doctors the time they need to rely on clinical management instead of a hasty prescription, it really does reduce antibiotic use. It has the potential to totally transform healthcare delivery.
That focus on individualized clinical management feels key. We saw one example in the sources, Omega Pediatrics, and they say they use telemedicine for exactly that, to provide that kind of detailed, individualized care.
Right.
They focus on making sure their young patients and, maybe more importantly, their parents really understand the plan.
And why it's important to complete the full prescription course when one is actually needed.
Right.
And that practical, patient-centered approach is what drives these success stories. The current success is mostly in diagnosis and prescribing for common things.
But the next frontier, and this is the really provocative thought to leave you all with, is using this technology for collaboration.
What do you mean?
Imagine using telehealth to quickly set up a remote diagnostic appointment with an infectious disease expert.
Oh, wow.
You could connect a doctor in a rural clinic instantly with a top specialist to guarantee the absolute best therapy for a complex case.
So you'd be minimizing guesswork and that broad spectrum use even further.
Exactly.
That kind of remote collaboration could completely redefine what optimal care even means.
And if you want more helpful tips, information, and details related to this topic, you should visit omegapediatrics.com. That's where you can explore their approach to individualized pediatric care and telemedicine.
And if you found this discussion valuable, please take a moment right now to Like this video, subscribe to our channel, and please share it with others who want a shortcut to being well-informed about public health and the future of medicine.
Thanks for joining us for this deep dive into the fight against antibiotic resistance.
So catch you next time.